Hi, and welcome to Tech Leader TV. I'm your host, John Thomas Flynn, and this is our 8th year of TLTV, and we continue with a stellar lineup of topics and guests, the show that everyone's talking about, a live streaming video webcast and cable television program focusing on public sector, information technology, and the political landscape. We come to you today courtesy of our sponsors, Unisys, LexisNexis, Xerox, Optum Government Solutions, Nexus, a data dimension company, Veeam, Comcast, Microsoft, CenturyLink, Tanium, Kronos, Information Builders, plus our newest sponsor, Absolute Software, for persistent endpoint security and data risk management for the mobile world. And finally, Flynn Associates, a California-certified small business enterprise and trusted advisor for strategic IT business development, marketing, and solution services. And thanks for watching. Tech Leader TV continues to set new audience records. Last month, in March, we had nearly 16,000 visitors to our website. We're reaching thousands of state IT decision makers and vendor partners who recorded 160,000 page views. That's 160,000 page views last month alone. Well, we have a very special program today with our guest, Kelso, the California Prison Healthcare Receiver, and his former Chief Information Officer, Tony Lourick, who was recently appointed Director of ECHOS, an electronic health record system at the receivership. Interestingly, Clark was our first guest on Tech Leader TV way back in the fall of 2008 when he was State Chief Information Officer. So in addition to a discussion about prison healthcare IT, we hope to cover our guest's perspective on the state CIO governance model as well. In fact, it will be exactly 20 years next month when I made the trek to Sacramento from Boston to attend the old Government Technology Conference and to interview for the state's first Chief Information Officer position. Upon my appointment by Governor Wilson later in 1995, Clark was one of the first people I met to discuss the job. I think little did either of us expect at that time that he would find himself in my CIO position in 2002 after a little IT procurement kerfuffle my successor, he who must not be named, got himself involved in. On a personal note, I have a great admiration for Clark. I've always pictured him kind of as a modern-day Lucius Quintus Cincinnatus, a 5th century Roman statesman and soldier noted as a model for civic virtue for his ability to lead the army as a dictator when called to do so, and then resign and return to private life after service. For in addition to rescuing the state IT organization, prior to that, he fulfilled a similar role as acting insurance commissioner and now afterwards as the prison healthcare receiver, all the while maintaining his real job as professor of law at the McGeorge School of Law. We're lucky to have Clark's former Chief Information Officer, Tony Lourick, here to see that Clark keeps his story straight. He'll keep him honest. So let's get started. As usual on Tech Leader TV, we're going to continue to do our best to keep the spotlight on the state's management of its annual multi-billion-dollar IT investment to make government more efficient and effective and secure. And hopefully we'll have a little fun and keep your interest at the same time. Our motto is simple. As I like to say, California can always do better. Let's begin the journey now with our discussion on technology, politics, and other unnatural acts. I'll be right back with our guests in just a moment, and we'll begin. Hi, and welcome back to Tech Leader TV. Enough about Clark. Let me introduce our other guest. Tony Lourick has been appointed the director of the ECHOS project, which is the implementation of an electronic health record system at the California Correctional Healthcare Services. Previously, he was the Chief Information Officer, and he's been with the state for 26 years, involved in everything from security, information systems, application development, and so on. So we're very And also, he has a great record of customer service, something we're very fond of here at Tech Leader TV, by the way. Clark, Tony, welcome. Welcome to the show. We're glad to have you back. And Clark, welcome as a return guest, shall we say. So let me start with this. Just so we talk, before we talk about what your role is and the receivership, let me just throw this one out, because I think it really says a lot about the challenge you faced when you started. And this comes from the United States Supreme Court. In 2006, a preventable or possible preventable death occurred somewhere in California's prison system once every 5 or 6 days. So that's the role you went in, that's the challenge you had when you went in there. Tell us about how the receivership got set up, briefly if you will, where it's been and where it's going.
Well, John, it's great to be back on the show. Although, you know, an 8 years before you would re-invite me back may say something about my first appearance here.
It's an indication.
Hopefully I'll do better on this one. The federal district court created the receivership in 2006, late 2006, because it decided that the state, which had had about 5 or 6 years to implement remedies for the medical system, the state simply hadn't done what it needed to. And the court decided that the only way it could accomplish what had to be done was for the court really to take over prison medical care. And that's what the receivership is. It's essentially a court order that a court-appointed official will operate and run the medical system. For the first 2 years of the receivership, a fellow named Bob Sillen, who was a well-respected and still is a very well-respected public health official, he had the reins. He did remarkable changes just in those 2 years. He was disruptive, but he did really a great service by raising the compensation level for providers so that we could hire good doctors, better nurses, and he started getting us on the route towards improving the system. I came in 2008. Basically, the judge wanted somebody who was a little more connected to state executive branch processes, who understood those internal processes. And we've been working very successfully for the last 7 years now to improve the quality of care.
Well, we'll get into that a little bit. So let's, since you know, we're looking at IT and politics and everything else, let's talk a little bit about your organization, in particular with Tony, with your IT organization, if you will.
Sure. When I started, one of the things that I thought was interesting about this particular challenge, there really was no IT to speak of in the Department of Corrections. What they still had was green screens. They didn't have a network so that you could operate system-wide databases. On a daily basis, they would ship around basic database information physically. And so you'd receive your disk for the day. So it represented really a challenge to build an IT system from scratch. And Tony probably can give you some details about where we are now. It's been a remarkable to watch the Department of Corrections build a modern IT system, which is what they've done over the last 5 to 6 years. And
we talked a little bit about this before the show started with Tony, about what you rely on for the Department of Corrections, what you do yourself. I know initially it was almost like a startup where you had to build your own system, so to speak. But more and more that's moved over to the corrections?
Well, we share the environment. For instance, our wide area network. We stood up a very robust network from the Mexican border, RJD, all the way up to the Oregon border where Pelican Bay is. And we share that with CDCR, with our custody counterparts.
So how large is the IT organization?
When I hired on, that's 6.5 years ago, I think we're at 15, 20 people. We're about 250 folks right now.
Okay. 250 just in IT.
And that's all across the state, though. That accounts for 3 to 4 people at every institution taking care of our medical providers' IT needs.
Oh, okay. So how big is the receivership overall then?
Well, the receivership itself is about 3 people.
Okay.
Because
bad choice of words, I guess.
One of the things that the judge wanted me to do was to prepare for the transition back to the state. And so I rather steadily, when I started, there was probably 50 or 60 people who technically were the receivership. And I cut that in half the first year and have been steadily letting people go from the receivership. So pretty much everybody else is a regular state civil servant, and when the receivership ends, all that's going to happen is the remaining 2 or 3 of us will go away. But everybody else is a state civil servant who will remain and will continue operating the system.
Okay, but the overall organization that you've got 250 IT people, how big is it from that standpoint?
Well, the healthcare organization is probably about 11 or 12,000 employees. On the purely medical side, I've probably got about 9,000. And again, we share some functions, so I'm still performing a lot of the HR and hiring functions, not only for medical, but for mental health and dental, which are still in the control of the state. But it's a pretty good-sized organization.
Sure, that must be a fourth of the whole correction department.
Just
isn't it?
about.
Yeah, because I think they had like 30-some thousand there now. Smaller than it's been in a few years, but that's a different story. So tell us about some of your projects right now. Tell us a little bit about ECHOS. Tell us how it got an acronym that doesn't fit with the name of it. I'm trying to figure that out, too. How about we start with the acronym and then try to work our way back with the real
the
name?
Electronic Correctional Healthcare Organizational System is what that stands for.
And what stage is it at right now?
Well, we've finished our build, and we're in testing, and that's very complicated because we're changing the way we do business. So this is probably 25% IT, but then that 75% is organizational change management. Do we have the right processes down for the clinicians to do their job and be accountable? And that's the kind of stuff we're looking at now. Our chosen vendor is Cerner. They're out of Kansas City. I think they're the #2 vendor in the world for electronic medical records, EMRs. And they're very good to work with. They know their business. We've established a really good partnership with them. But it's as they say, the devil's always in the details.
Right.
Our pharmaceutical formulary, do we have that right? How does that merge when a doctor orders, I don't know, aspirin 3 times a day? Hopefully that's what comes out at the other end. So we have to test all of those types of systems.
It was somewhat complicated also because I assume there's a number of state agencies now that have patient record system, state hospitals, for example, or others that may be involved in this. And, I'm looking back on my involvement with the U.S. Government Accountability Office where there's a huge fight going on between the Department of Defense and the Department of Veterans Affairs about whether they were going to try to get together and build one. Well, they can't get together, so they're building 2. Was that a consideration of yours? Did the state have anything comparable that you could utilize?
Not initially, but Jamie Mangrum, the CIO at Department of State Hospitals now, was our CIO. When I hired on, he was my boss. Yeah, he's a great guy. Learned a lot working with Jamie. But we've been talking throughout the years.
Didn't show up. That says something, huh?
And now what we're doing is, because we have this established, I'll call it infrastructure for a medical record system, how can we partner with the state hospitals to reduce their costs?
Sure.
That's what we're working together on now.
Well, certainly, it's an interesting time, certainly with the Obamacare and everything else about medical records, the Affordable Care Act, and it's certainly right in the target of a lot of these different initiatives around the country, for sure. Big project. When will it be? How large a project is this? Let me ask you a question before going any further. Tell us how your organization is situated in terms of state regulations for things, procurement, hiring, all that. Are you autonomous, or do you choose which ones you want to play in, or how do you do it?
Well, there are a few things where we have court orders authorizing us to do things that other state agencies can't do.
Okay.
So procurement is one where we have authority. If I decide that I really have to use a federal process, we can do things a little quicker than the state typically can do with IT procurements. But for most things, including at this point IT governance and oversight, we're really trying to live within the state system.
Okay.
So we've got IPOC and IB&V, and the state CIO's office is part of our oversight.
Okay.
And we're doing the reporting to them. So we're trying as best we can to keep within state process.
It's interesting, though. I didn't find anything for your organization on the tracking system of the CIO's office. Maybe that's a different issue. But anyway, for example, did you have to bid that out? That patient record system, was that a competitive bid?
It was.
Okay.
Yes. We did an FSR, and we went through all the state procurement processes.
Okay, so you do FSRs as well.
For this project, we did. Yes.
How large a project is it?
In terms of
dollars?
I think our FSR is $182 million.
Okay, so It's California size, right?
It's California
Yes,
size. It's a big project.
Yeah, and you're supposed to make those small projects, right? We always talk about that, but
Well, part of the challenge is, and again, it's not all IT. It's all of the, a lot of expenses associated with how do we get all of our doctors, all of our nurses, all of our clinicians, and that's 3/4 of our employees are on the clinician side. How do we get them to modify their daily work practices so that they can use this system and become more efficient in what they're doing? That's an expensive thing to do when you got a large organization.
Well, speaking of that, I just read recently where the Department of Corrections, again, has spent something like $700 million in overtime. Even though there's significantly less prison guards right now and prisoners, they still had a huge overtime bill. And a lot of it went back to issues like timekeeping and all that. And I know that in the healthcare, in the correctional system, you know, you see so many a lot of folks with you know, making a significant amount of money, you know, working almost 2 jobs within the state because they get so much overtime. How do you, what's your plan to attack that? And how are you doing it now? And what do you plan to do?
Well, the overtime problem, and I'll talk just about within medical care, because we have a significant amount of overtime as well. We actually have sort of, I consider it, 3 types of employees. We've got full-time working regular hours. We've got then the overtime grouping, same people, but I consider it sort of a separate issue. And then we have something called registry providers, who essentially are outside consultants, doctors, who we retain on an as-needed basis. So we've been able to supplement our workforce with outside providers. Now that creates a challenge in the civil service system because we've got 2 doctors working next to each other. One's employed by the state, the other is employed by an outside provider. We've had to do it in order to make sure that we had enough clinicians to cover the need. But our policy has been over the years, I want to reduce our reliance on the registry providers. I want to add people to my first class of just regular full-time employees, and then I want to reduce overtime. So that's what we've been trying to do. We've been trying to get the numbers right between those. It remains a challenge, though, because there are a lot of moving parts in this system.
On that moving part issue, so, and we talked about it a little bit before the show, so for those employees and those contractors that you named, how is the time kept? Is it in that human resource system over at the corrections office, or is it something you do internally? How are you doing that?
Well, that has changed over time. We have more recently now been using the CDCR's BIZ system, and I think they're in the process of implementing the time shift. So we've been part of that BIZ project from the very beginning, and you know, I made a commitment early on to the department. I didn't want to have a separate BIZ type system within the receivership. I wanted to try as much as possible to use their existing systems.
So tell me about what are some of the other projects you're working on, IT-wise?
Well, as the director of ECHOs, that's my singular focus.
Okay.
Go live in our pilot sites October 27th. But then there are other, say, projects that we need to get done to support. For instance, wireless access points in the institutions. Medical equipment is going wireless. And when we stood up our medical grade network, we did put some wireless in, but we left areas uncovered. Over the years, as the inmate population has reduced in the institutions, healthcare was able to expand into some of those areas. And they may not be, or they may not have adequate wireless coverage today. So that's one of the projects that we have to time with our go live.
That always gets a lot of people nervous here. Prison and wireless get a little nervous.
It does, but we monitor that, and it's very secure.
Anything else?
Right. Well, you know, one of the things that we did in the past was we stood up a robust telemedicine system that has been very important to us. And that was a lot of fun from an IT point of view. And I think has provided a lot of benefit to the receivership in terms of achieving access to care for our inmate patient population.
So this wireless initiative, is that something that's coming up, you're saying? That
We're doing that now.
Okay.
Yeah.
Are there any procurements that are coming up that our vendor friends would like to hear about, be interested in?
None that I know about right now.
Okay.
You know, we've pretty much...
We could shut this show down right now.
So I've not really been involved in the day-to-day of IT for several months now.
Who is your replacement?
So we were really lucky in that area. About 5 years ago, we hired someone, Cheryl Larson, out of the Franchise Tax Board.
Okay.
And then she went over to our activation team.
Okay.
And spent 5 years standing up places like Stockton,
okay.
The 1,700-bed facility that we all probably know about. And I was able to recruit her over to replace me when I became the CIO. So she was perfectly suited to become the acting chief information officer and is in process of competing for that position as we speak.
Oh, I see. Okay. Okay. Great. You know, some of the things that I keep thinking about your job, and I think of that quote from the Supreme Court decision. You know, you really had a target on your back these last few years, and I'm sure it's been at times somewhat of a thankless job. I guess you can the relationship that we've read about with the governors probably plural, and also the prison advocates, if you will. I'm sure that from some of the stories I read, nobody seems to be too happy. But then you've got the court, which I guess is your executive champion in many respects. Could you just talk about that a little bit and how you're able to, because we always say about these big projects or any big initiative, whether it's IT or not, is to have an executive sponsor, an executive champion that's got your back. How's that in your role?
Well, the court is my executive sponsor, and you know, that's where I draw really all of my authority from, and a great deal of the credibility that I have in the position. Now, you're quite right that at times the relationship with the state has been a little more frosty. Usually that's related to litigation, where either the state has made some motion to change the work that I do, or I made a motion. And of course, once you get in litigation with somebody, you tend...
Relationship changes.
Relationship tends to change. Now, I'm happy to say that when we're not in that type of litigation, the relationship with the state has been really quite good. We've maintained good relationships with the Department of Finance in particular. That's an important one. I think the governor's office at this point is pleased with the direction that the case is going. A lot of what I do depends on what order does the judge enter. And just a month ago, the judge entered an order that basically set a pathway for how the medical case will wind down. And it basically is going to involve the Office of Inspector General.
When you say medical case, what does that mean in terms of what we've been talking about?
Sure. I'm responsible for medical care.
Right.
There is another federal case involving mental health.
That's right, yeah. Okay, gotcha.
And we coordinate with it, but it's a different case. Judge Henderson has entered an order that will have the Office of Inspector General do assessments of medical care at each of the 35 prisons. And that's going to happen over the course of the next year or two. As the OIG decides that care is adequate, we're going to start turning those institutions back over to the state. So right now, I think we're in a very good position where the judge has clearly indicated he thinks we've made enough progress to start the process of winding down.
Okay.
And that's where we are. It's a good place to be.
Let me ask you another question. I know in some of the research I did in anticipation of this program, another issue came up. It's another word we dare not say in Sacramento, and that's outsourcing. And I know that you've actually, as I understand it, there is some outsourcing of medical care in some respects. How'd that come about? How's it going? Is that a direction that the state is heading in, or is it just one of the arrows in the quiver, so to speak?
Well, a lot of it simply has to do with what are we capable of doing within the state system. If we outsource hospital care, well, that's because the state really doesn't run a hospital. And you know, when you take a look at what's involved in building a hospital and operating it, that's just something we're not going to try to do. So we've outsourced hospital care. There are a lot of specialties in medicine where at times we're going to need somebody who is a specialist in a particular field, a particular disease. Well, we don't want to hire specialists just for our population. That's not going to be cost effective. So we outsource that function. What we have kept a hold of is primary care. The doctors who and the nurses who on a daily basis are able to provide appropriate care for the same sort of things that your primary care doctor would do. And that's been enough of a challenge, just doing that. And we really haven't had any difficulties in explaining that division. Primary care, the state can do. I think we've proven that we can do it. A hospital care, specialty care, that's something you're going to outsource.
The other thing I was noticing as in preparing for this show, you know, when you do Google searches on some of the stuff and look at the challenges that come up, and one of the, I mean, it's like when you come to work some days, you can't imagine what you're going to see in the paper that's also going to be your first phone call. And one of the things I looked at was that whole sterilization issue. I mean, it must have came out of left field or something.
Well, that was an interesting one. It did come a little bit out of left field.
And just for we're talking here about the fact that there were prisoners, women prisoners, that were, by some respects, sterilized without them knowing it was happening, or didn't give full consent to it, I guess is what they're saying.
Yeah, and we first learned about it, I think it was back about 2011. And when I first discovered this was going on, we put a stop to it in 2011. And we tried to put in place some systems to make sure that it wouldn't happen. So one of the main systems was we adopted a policy that we would not pay a hospital for sterilizations unless it had received a very high level approval. And once the hospitals realized we weren't paying,
that's a quick way to stop it.
That was a quick way to stop it.
Interesting.
Now, the issue came back. We thought we had addressed it. But then about 2 years later, the issue came back and suddenly became something that quite a few members of the legislature were justly concerned about. From my perspective, boy, we thought we had addressed this 2 years ago. But instead, no, we had to go through a process, have an audit come in. You know, that we had to go through the usual sort of review that you do when something bad has happened.
Well, now you got a new one coming up, this one with the transgender and sex changes in the prisons on taxpayer dollar.
Yeah, that's been an issue that's been percolating around the country for quite a while.
I don't want to get into it too
whether
deeply.
The Constitution would require...
I just wanted to let our audience know the challenges you face are not just strictly bits and bytes.
No, they are not bits and bytes, and they do tend to land on the front page. Sometimes, as you say, when you least expect it, you suddenly have a story pop up.
Hey, let's shift the discussion over a little bit, because it's a topic that I know you're interested in and I'm passionate about, and that's the whole CIO governance model, and particularly as we look at the state of California over the last couple decades. And not only that, but you've been to NACIO, the State CIO Association. You've talked to your colleagues around the country, both of us have, in terms of the CIO and the challenges that they have. And recently, it seems, again, we're noticing that there's a number of the state auditors come out with a number of reports about the ineffective project management, ineffective project implementation. It's one of those things that just keeps happening. What's some of your thoughts on what's wrong and how it could be fixed?
Well, I think my first thought is there's a lot more success in executive branch projects than people realize. And I think I heard the current state CIO, Carlos Ramos, I think he's got some listing of, hey, you know, we had some failure here, but I have 185 successful projects. So I think that one thing that does need to be appreciated is there are a lot of projects that don't get recognized.
Sure.
And just corrections. My goodness, we've had $500 million worth of projects in the past 7 years that have gone successfully. But nobody really, you know, thinks about that. What you want to focus on is the big project that went badly. So I think you have to provide a context for that. Second, as you know, John, in the private sector, 60 to 70% of projects technically fail because either they're over budget 10% or they don't achieve the goals or they're delayed. and again, I think you have to understand that context, that it's not like Silicon Valley is a place where everything magically works.
Sure.
It's littered with project failures. That helps put, I think, a better context around the state's performance.
Well, I think that's true, but you know, at the same time, I think one of the frustrations of the general public and the legislature and other observers is that when there is failure, there don't seem to be repercussions.
Well,
like there would be in
and I do want to. I don't want to be just a Pollyanna-ish defender of the state's IT program. What I have seen in my time with the state here is the biggest failures tend to be not IT failures. They tend to be failures in the organizational change side of a project, where either we don't make the changes that you have to make for the project to be successful, you don't have employees who are able to use the system, and that's a serious problem. We don't appreciate well enough just how difficult the organizational change aspect is. I think related to that, on these big projects, it does seem to me the director of whatever the agency or department is has to own the project. You can't delegate this down somewhere and just sort of let it happen. Because inevitably in these big projects, issues are going to arise that are going to demand action by the director. And I think you have to own it from the very beginning and send a signal to your agency. We're going to make this work. We're going to make the organizational change aspect work. On a monthly basis, I'm going to meet with my project lead, and I'm going to get a report back. I'm going to listen to the IV&V. I'm going to listen to the IPOC. But I think that sort of executive leadership is absolutely critical to success.
It is, and it's one of the things that we find more and more doesn't seem to be occurring.
Right.
But that's often been pointed out that you do, and I think it's one of the most important aspects of a successful project is to get the executive involved in that kind of decision making, and it's very difficult to do a lot of times because I can remember sitting down with the director of child support, talk about that project, and she told me at the time she had 12 more important things on her desk than this $300 million IT project.
Well, and that's a great example, John, because when I came on, they were still doing that project. And one of the things that we instituted was a monthly meeting with the department director and the agency secretary, so that I was making sure that the top executives were aware of problems as they were developing. It made a huge difference because Kim Belche was the agency secretary at the time, and when she decided to engage in something, it was with full intensity. And I think that's what made a difference finally, that and the $200 million federal penalties that we were incurring annually. That's, I think, what made the difference in that project finally being successful.
You know, it's interesting, your successor, Terry Tagay, who you and I were both big fans of and did a great job, you know, she, and one of her, I really think certainly her crowning moment was getting the CIO position made an agency with a cabinet agency and all that. And I was so disappointed when the governor came in and just without a wink and a nod, you basically just demoted it to a department again. And how you know, it'll take 10, 15 years to get that back to a cabinet level position if it ever will happen. And you said, and that's one thing about that I criticize about the governor, you know, his idea of technology initiative in this state is to confiscate smartphones and shut down the Transparency Office and demote the CIO. It's very disappointing, and I know that's affected we try to put a smiley face on it, but the truth is it's very disappointing, and when you talk to people around the country, they're very shocked. The other departments are trying to get to that level, and they hear that happen. It's very disappointing.
Well, and as you know, this comes in ebbs and flows, even in the private sector. You know, I was here at a time, and I think when you were here in the private sector, that was the time where we're raising the CIO up to the executive level and the height of private sector entities. As you know, that doesn't always remain true. Well, sometimes you drop down into admin or something.
When I was interviewed for the job, they told me, oh, you're cabinet level position. Little did I know there's a difference between cabinet level and cabinet member. Big difference, big difference. Anyway, so there's a number of we talked about the private sector advisory groups. I thought that was a very successful model to use. I actually did a presentation one time at NASCIA about, you know, how to set up a private sector advisory group, how to staff it, how to make it productive, and how to make it not become a pain in the butt. That was really the thrust of it. But that can be a good sounding board and could be kind of running interference for you in a lot of cases. And what's your experience in that regard?
Well, I agree with you, John. After a couple of years, probably around 2004 or 5, I put together a private sector advisory group for the same reasons I think that you've suggested. It's a good idea because they're able to tell you things that when you get their trust, they're able to tell you things very honestly that you're doing wrong. And
they can run interference for you with some people who don't believe you.
They can easily run interference, and that did happen with my advisory group. I had some people on it who were fairly well connected politically. I do think that's an important thing to reestablish. You do get good advice. It helps you with your own credibility and confidence. And as you say, if somebody challenges you, they can help say, no, your state CIO is doing it right. You need to listen to them.
We've only got another minute or so to go. What are the changes happening? You said a couple years left in receivership. Where do you see that eventually going? We love scoops here on this show, so anything you can tell us that nobody else knows.
Well, there's no timetable.
Pays the utility bill, you know what I'm
saying?
I
understand that. No timetable, so it's not like there's a date certain. It's just going to depend on how well we do in these OIG assessments. So as you can imagine, one of the things we're doing right now, we are right now trying to figure out how are we going to, very quickly, in the next year or two, get our lower performing institutions up to speed. Because right now, out of the 35, you know, we've got a high number that are doing very well that we think will pass the test, but we also know we've got some of the bottom that need some real attention. So right now, we're focusing a huge amount of our attention on that group. And we'll just have to see how well we do on these OIG assessments.
Have you visited 35? How many prisons have you been to?
I have not visited 35. I've probably visited about 13 or 14, and that was mostly early on in the receivership. At this point, part of my job is to, of course, still really put myself out of a job. So I don't travel around much trying to micromanage what happens in the prisons. We've got a good organizational structure. I don't want to jump over all of my own staff and start barking orders.
Right, I understand. Well, listen, it's been a great show. I know we're going to be able to kind of go over some of the more provocative items that we discussed earlier at our reception afterwards with our sponsors, but that will conclude our program today. I want to thank everyone for watching. We really appreciate your ideas on some of the topics for the show and guests we should have. So they'll keep on watching. A special thanks, of course, today to Clark and Tony for joining us. It's a fascinating challenge they have. I know that recently saw that Alan Turing movie about World War II movie about the Enigma project, and Turing was a British scientist. And basically, at the end, he really didn't think he'd done anything. But it turns out his assistant, who was actually his wife, told him that he said that, you know, I drive around England, and there's cities and towns that exist because of what you did, and there's people in those cities and towns that are alive because of what you did. So I think a lot of what you're doing is certainly in that kind of mold, and we congratulate you on that and wish you all the success in the world. Thanks very much, and we'll see you next time. Bye-bye.